866-224-5422. That's AMP2.TV.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the program. Happy New Year. It's hard to believe we're here in 2018. It is flying by, but we're here to bring you the latest in health news, which we have a lot of it tonight that's timely. If you're ever looking to see a little bit more about the show, the videos are on allcountyhealthcare.com. We're also on Facebook Live, which I'm sharing right now. I always remember to share it at the beginning of the show, so you can share it to all your followers. And if you'd like to have your doctor on the show, you can contact me through All County Healthcare Incorporated's website or Facebook page as well. And there we go. We're sharing it in some amazing technology these days. Sometimes we get questions from Facebook Live, so that's great too. But I don't want to waste too much time, so without further ado, I want to introduce you tonight's guest. He's Dr. Andrew Zwick, gastroenterologist with an office at Digestive Care, which has many locations. I'm going to tell you a little bit about that, and on staff at Delray Medical Center. Dr. Zwick, welcome to the program. How are you doing tonight?
David, thank you for having me. I'm doing just fine, and Happy New Year to you and all your listeners.
Yeah, Happy New Year to you, too, and all the listeners. Now, what did you do for New Year's? You had quite a festive night, huh?
I did. Like many of my peer group, we went to the Billy Joel concert for New Year's Eve at the BB&T Center, and that was absolutely amazing. 68 years old, he's still got it.
That's great to hear. I saw a lot of it actually on Facebook. I had a lot of friends who went to the show, and it really looked like it was a nice set that they had, and I saw some really cool lights that he had, but he does quite a show. I heard this was his third year in a row that he was doing it for New Year's.
Yeah, I'm not sure if it was second or third year in a row, but I know I missed it last year, so my wife said we have to go this year, and who was I to say no? But nice. It was a grand time for those who went, but I hope that everyone had a great time, whatever they were doing on New Year's Eve.
Yeah, definitely. And I was actually in Delray, saw some fireworks, so that was really neat. I have a 6-month-old, so that was like the night right there, but it was awesome. And did you have a highlight of the Billy Joel concert? I mean, what was your favorite part?
Well, I don't know if there was a highlight. I mean, just the whole experience of being there was nostalgic. I'd seen him many years ago at the start of his career, and so it did make me feel a little old. But I'd say the highlight was the countdown at the end of the evening when he sang "Auld Lang Syne" for the crowd.
Oh, nice!
It was a nice moment.
That's really neat. I always ask that question because I like to, find out a little bit what doctors do outside of medicine, because I know you're a very busy physician, and it's nice to see that, it's kind of cool that you're a Billy Joel fan. I think that's really neat. But let's get right into it. I know that you have a new procedure because you were actually on this show a month ago, and you're really grateful with your time. I really appreciate it. You kind of took us through the whole gamut of GI treatments available today. But then I saw you on the news this past week on Channel 5 News, and then I was searching your name online. I saw Channel 12 News. Then you're in South Florida Hospital News and Healthcare Report, all for a new procedure. And correct me if I'm wrong, if you're one of the only ones in this area doing it, it's the Tif procedure?
Yes, not the only one. There's a wonderful general surgeon in Okeechobee also who does this procedure. But as far as I can tell, I'm the only gastroenterologist so far in South Florida. But with the efficacy of this procedure, I think a lot of other doctors will be training and learning how to do this and offering it to their patients.
I see. Is that the other doctors in Okeechobee County or Okeechobee the city? So
Okeechobee, the city.
Okay, so that's another one in Palm Beach County.
Yeah.
But you're the only GI in this area doing it right now. Yeah. So I do a lot of research for these shows, so I always like to find out what the acronyms are, and this one is really interesting as well. But it's known for short as the Tif procedure, TIF. That's correct?
Yes.
Okay, so I did the right research there. Now what is to just kind of set this up, what is the most common complaint people come to your office with in the first place? You're a gastroenterologist, so a GI doctor.
Right. So the most common complaint that people will come to the GI doctor for is usually one of two things. It's either basically problems with their bowel habits in general, or heartburn. Reflux-related conditions make up one of the most common complaints.
Okay, so when heartburn affects quality of life issues, or maybe even sleeping. I know I've had a few times, and I think we'll get into this, how it kind of comes up, that acid reflux, is that the same kind of thing?
Well, acid reflux is the disease. Heartburn is a symptom.
Oh, okay.
Heartburn is, we all think about that burning sensation that we occasionally get in our chests as the disease, but the disease is formally known as gastroesophageal reflux disease, or Gerd.
Gerd, okay, I saw that acronym.
Gerd patients come to see us. But the heartburn is a sensation you get when the acid is coming up and if it affects you. Reflux is normal for everyone. Everyone has some elements of reflux. Mm-hmm. At some time, you can measure this in people, that they will have times when acid will come up into the esophagus. It just depends how long, how often, and how sensitive we are to the presence of the acid or the stomach contents themselves within our esophagus. But that general, burning sensation we get within our chests, we call heartburn. Sometimes that reflux will come so high that it gets up into our throat areas. We've all had, sometimes a high heartburn or even regurgitation into our throats of stomach contents and acid, especially at night when we sleep, we lay down. It's more common to get reflux back up into your throat. When that happens, we call it LPR, or laryngopharyngeal reflux. But that might be getting a little too technical.
No, we like that info.
But when it gets up high, we call it LPR rather than Gerd.
When it gets up high, so traveling high into the esophagus.
Gets high all the way up into your throat area. And when acid and stomach contents get up into the throat, they can get into your airway, where you breathe. And that can cause often what we call high reflux symptoms: coughing, gagging, sore throat. It can lead to asthma in people. It can lead to chronic sinus problems, ear problems. And those are often the things that affect quality of life. not just acid heartburn causing pain and trouble with your eating, but when acid heartburn causes these higher symptoms, it can affect how you sleep, because people wake up from sleep with reflux in their mouth, coughing or wheezing, and that affects their sleep, and it affects their energy. You can become chronically fatigued from this, and overall affect your quality of life, let alone how you eat and how you digest.
So this is like sometimes that burning that is going on, that when that gets so severe that someone would actually call your office or go to the hospital for it, that's when they have a case of Gerd that needs to be medically treated, correct? That's
true. Reflux accounts for approximately 3 to 4 million hospitalizations each year.
Whoa, I didn't know that many.
And not just people coming in with heartburn, but related problems because of heartburn. It's a very costly disease as far as time, as far as decreased productivity. We think from latest estimates that heartburn decreases productivity in the United States by about $2 billion a week. Of lost productivity in the overall workforce because of symptoms of heartburn, causing people to either miss work or to be distracted from their work or less productive because they don't feel well. Those are estimates, about $2 billion a week.
So when over time, when this obviously affects quality of life, but then it can also affect your entire life, your ability to make money and make a living as well, and that's when people have to see, a GI specialist like yourself.
Yeah, absolutely.
Now, how come, like, in the middle of the night, if you drink some water, how come it just doesn't wash it back down and the stomach acid doesn't stay there? How come that doesn't really work?
Stomach acid fluctuates at a pH anywhere from usually between 2 to 4. On the pH scale, with 7 being neutral. So very acidic. And people can produce very large amounts of acid, say in their stomach, which you can tolerate. If you reflux and then try to wash it back down with water, you're simply diluting the volume, but the acid is just so strong. And when you think about the mechanism of reflux, which we can get into in a moment, it washes down, it just comes right back.
I see.
So you may get a little temporary relief as you're washing acid away, but it comes right back, even though you're diluting down. The acid is so concentrated and so strong that it will continue to give you symptoms despite neutralizing it with water, which is neutral, not alkaline.
Now, and you said before this is more prevalent at night. That the people see these kind of symptoms.
About 50% of people will say their symptoms are worse at night. 50% may say during the day. But the reason people get perhaps more severe symptoms at night is because when you lay down, you're obviously losing the effect of gravity. So if you're laying flat, stomach contents that still may be remaining in your stomach or acid is being produced can just roll right back up your esophagus. There's no gravity holding it down by staying upright. That's why you often hear about one of the treatments for nocturnal reflux is to put your bed up at an angle, put some bricks under the bottom of the legs of your bed and at the top of the head, and raise yourself at an angle of 30 to 45 degrees so that gravity is still in effect as you sleep. Of course, that's not always popular with the person you may be sharing a bed with. And sometimes you got to watch how you don't slide out of bed doing it. But that's one of the non-medical ways to try and treat nocturnal heartburn is to prop up the head of the bed at an angle.
Unless you have one of those fancy beds where it doesn't affect your partner's at this angle and you're at this angle.
I just bought one of those beds.
Really?
And for the price I paid, I don't know what's worse, the bed or buying pills.
That's good to know because I've wanted to save up and talk my wife into that. We're going to take a quick commercial break, but on the other side, we're going to get into a little deeper into the Tif procedure for acid reflux, which we just found is the disease and heartburn is the symptom on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your all-county healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back on the You and Your Doctor show with Dr. Andrew Zwick. He's a GI, a gastroenterologist. I just want to say thank you before we get back into the interview to All County Healthcare Incorporated for sponsoring this show. They always have the in on living a longer and healthier life. They're a Medicare certified home health agency. If you have any questions about Medicare and home health in general, you can call Maddie at 1-888-717-7170. And the Facebook Live listeners will see that's the number right behind my head. And ask for Maddie, and she can answer any of your healthcare questions. And they're also, all their videos, health videos featuring the interviews with the doctors are on allcountyhealthcare.com. And as you know, their Facebook Live page, so just type that into the browser. You can always ask questions Facebook Live during the show, or call 1-888-565-1470 here and talk with myself and the doctor while we're in the studio. Dr. Zwick, I want to really find out about that Tif procedure, but I know it's important to describe why acid reflux happens. So why does acid reflux happen?
Well, acid reflux happens because of a breakdown in the body's ability to keep the acid from coming up from the stomach to the esophagus. Normally, there's a barrier at the junction between our esophagus and stomach that will prevent acid from coming up. It's a combination of a muscular sphincter, a muscular layer we call the lower esophageal sphincter, and also what we call the flap valve, which is created by the acute angle that the esophagus enters down through the hole in the diaphragm and joins into the stomach. It comes in an angle. Over time, the ligaments that hold the stomach and esophagus into position, in the right spot inside the diaphragm, can break down, and therefore that angle of entry that creates the flap valve disappears, and you get more of a straight angle or perpendicular right through the esophagus and through the diaphragm into the stomach. So you lose the flap valve. When that happens, you can sometimes have herniation of the stomach, where the stomach rises up through the diaphragm into the chest, either a few centimeters or sometimes to a great degree where I've seen some people, the majority of their stomach is sitting in their chest, not in their abdomen. These are the two processes that go on to break down that barrier. So then acid, which is rolling around as your stomach is squeezing and in motion, can get past the barrier and roll up into your esophagus and potentially cause those symptoms we talked about, heartburn, which can then lead to trouble with scarring and damage to the esophageal lining, which can lead to stricturing, lead to trouble swallowing. Belching and burping sometimes comes as a result of this. You can get changes to the esophagus from long-term acid exposure that give you a higher risk of developing esophageal cancer. Esophageal cancer is the fastest growing type of cancer in the Western world, partially because so many more people are having acid reflux. And you may ask, why is more people having acid reflux? That gets down to the fact that we're breaking down our barriers. Why? It's unfortunate, but it's a lot has to do with our diets, being higher in foods that decrease pressure of the sphincter, and also, unfortunately, because of obesity. People who are of heavy weight gain weight, break down that barrier easier and get more reflux. So one of the tenets of control of acid reflux and heartburn is to try and lose weight. It's been experimentally shown that just gaining a few pounds can lead to increase in heartburn. Losing some weight can decrease your heartburn to where you don't even need pills sometimes if you lose enough weight. So really we're talking about the cause of reflux as being that barrier, the lower esophageal sphincter muscle and the flap valve, which is a natural part of our anatomy that basically disappears for various reasons over time.
So yeah, that's fascinating that the geometrics of someone's anatomy and the changes in that anatomy over time, whether it's like you said, the ligaments are kind of loosening.
They lose their elasticity, they weaken, and things slip out of position.
Yeah,
so
definitely.
you can it's if you think about it, if you have a drain that's supposed to close, but it slips slightly out of position, you're just going to either be stuck open and it won't close.
And the other side of that I think you're getting to was becoming heavy also changes the anatomy of that the esophagus there.
Right. Increased intra-abdominal pressure from weight is part of it.
Wow.
Yeah.
Now, you mentioned esophageal cancer, as a gastroenterologist, that's something that you diagnose, or does that go on to a super specialist?
Unfortunately, it is something that we diagnose.
Okay, so you do see that when
we see that often when people are complaining of trouble swallowing or weight loss. Sometimes they find that there's blood in the stool on routine testing. Often we'll find that that's the culprit is esophageal cancer, which is a very difficult cancer to treat, and no one should ever have it. But it's on the rise because of increased acid exposure time, heartburn, and the changes it causes in the esophagus. That's a whole other subject.
Yeah, definitely. Just briefly, how is it treated, though, esophageal cancer?
Esophageal cancer is usually treated with a combination of surgery. Sometimes you have chemotherapy or radiation before surgery, and sometimes afterwards. But esophageal cancer can be difficult. It spreads easily and quickly, and the prognosis is not great. Better than it was many years ago. We have newer techniques, but it's not the type of cancer you want to have. It's not the diagnosis you want.
I could tell your tone of voice. It sounds like a tough cancer to diagnose and treat. So we're here with Dr. Alan Andrew Zwick. See, I did it. My dad's name is Alan. I don't know why I want to keep on calling.
My best friend's name is Alan. We'll take it.
So, okay. Dr. Andrew Zwick, and he has an office at Digestive Care. Great website. I've spent a lot of time on this website. lovemygi.com. Great website name, too. You can find out more information there, and he's also on staff at Delray Medical Center, and right here in Boca Raton, Boca Regional Hospital, right down the road. Two great hospitals in our Palm Beach County area. Now, I wanted to ask you one more question before we got into the procedure. Does eating at night, late at night, can contribute to this type of...
Absolutely. When you think about it, you eat late at night. It takes the stomach, depending on who you are, an amount of time to grind up the food and empty it into your intestines in the normal act of digestion. If you eat late at night, you lay down, you go to bed, or you lay down after your evening meal, you don't have gravity. So you've got a full stomach producing tons of acid, to try and digest. And even if you do wait just a couple hours after your evening meal with a full stomach, you still have a lot of undigested food in the stomach and a lot that's in the intestines that can still roll back up into the stomach and back up into the esophagus. So one of the things we tell people to do when they have bad reflux, or especially nocturnal reflux and heartburn, is to wait at least 4 hours after your evening meal before you lay down flat. You stay in an upright position. Don't eat late if you are a nocturnal refluxer. You're just asking for trouble.
And it gives the body time to rest and rebuild and with the cells and whatnot.
Time for the pH in the stomach to rise to higher levels, less acidity.
Oh, nice to know. Now, there are other options available for acid reflux, heartburn, GERD, besides the Tif procedure, which I know we're going to get into.
We're getting to it.
Yeah, we are. But what are some of the other common treatments that you've done for a while in your career?
Well, most people by now know that heartburn is often related to the types of foods we eat. Okay, certain foods will be more likely to induce reflux and heartburn, partially because they act to lower the pressure of the esophageal sphincter. The muscle area has a certain tension to it, and you can lower that tension with certain foods. The common things we talk about trying to avoid when you have heartburn: caffeine, coffee drinking, tea drinking, soda drinking, chocolate because it has a lot of fat and caffeine in it. Spicy foods is very, anything that's tomatoey, red
I heard
food.
Tomato sauce recently.
Yeah, tomato sauce, unfortunately, Italian food, for all the Italian food lovers out there, that's what we use in experiments to induce heartburn when we're studying it, is give someone a pepperoni pizza and a Coke, and it's almost guaranteed you can induce reflux with it. But Italian food, spicy food, fatty, greasy, fried food tends to do it as well through hormonal mechanisms.
Hot sauce?
Hot sauce, not really.
Really?
Not really. Surprisingly, not. Hot sauce doesn't seem to have that great an effect on actually causing heartburn per se, surprisingly. But certainly some people will be sensitive to the hot sauce in their food, but it tends to be more the food you're putting the hot sauce on than the hot sauce itself.
Greasy, oily food.
Right. We also find for people need to know that peppermints, mint candies also have a chemical that will lower the sphincter pressure, add to reflux. So there's a certain diet and things you need to watch. People associate citrus foods as well, things that are high in citric acid, orange juice, grapefruit juice. Yeah, anything high in citric acid also can induce reflux, make heartburn worse. So there are some restrictions we give people, and sometimes that's enough. I've had patients who drink copious amounts of coffee. They'll have 3, 4, 5, 6 cups a day, and they want to know why they got such bad heartburn. Then they, have a big lasagna for dinner and go right to bed.
Yeah.
Some people will tolerate that, others don't.
Like that combination. Yeah.
So after you do some lifestyle changes, losing weight, loosening up your clothing, sometimes people's clothes are just too tight. Loosening up the belt.
A belt being on too tight can do it?
Right, sometimes do it. Occasionally for women, a brassiere that's too tight can affect it. But really the commonplace treatments people think about now are using medications. And we're all familiar with the class of medicines we call the H2 blockers or histamine blockers. That's our Zantac and our Pepcid that you see advertised, has been on the market for a very long time. Very effective at decreasing stimulus to acid production. You lower acid production, you get less burning, less reflux, higher pH in the stomach. And they can be very rapid onset type drugs. So they're good to take for the occasional heartburn because they work faster than some of the other treatments. You can always reach for the typical antacids, the Mylantas, the Maloxes, the Tums, the Rolaids. These often have ingredients in them that will neutralize stomach acid. It can be very effective for some people.
Pepto-Bismol?
Pepto-Bismol, somewhat. Not quite as effective as some of the others, but it can be. I wouldn't recommend it as a routine heartburn reliever.
Yeah, these are all just patches, and you need to have the whole tire fixed if it's something that's always a problem.
Absolutely.
You need to have that whole fixed.
And for people who have tougher heartburn that these things don't work for, people who have chronic heartburn, That's where we have the drugs that are called the proton pump inhibitors. These are the Prilosec and the Nexiums that you see advertised on TV. But there's a whole host of prescription acid reducers that are what we call the PPIs, the proton pump inhibitors. These are very, very strong. They lower acid production by 1,000-fold, almost completely shut it off. And they are very effective at helping symptoms of heartburn, reflux, as well as healing gastritis and ulcers and other acid-related disorders. So they've become among the most widely prescribed medications in the world. However, here's the rub. The acid-reducing medications, the histamine blockers and the PPIs, over time may become ineffective for people. Your body can get used to them. Sometimes you have to change the brand to a different chemical structure and you'll regain the effect. And if you stop them, you can get a very strong acid rebound. So people who suddenly stop these strong acid medications can get horrible heartburn the next day because it's just a big rebound effect in the stomach. But we're here also to talk about other things that you can do for bad reflux. A lot of people don't want to take pills. A lot of people have read in the literature recently and in the news that these acid-reducing pills, especially the PPIs, have been associated with sometimes long-term side effects. People use it for more than a year at a time, such as bone loss, anemia, increase in community-acquired and hospital-acquired pneumonias, increase in diarrheal infections from it. There's some literature to suggest it may be a cause of acute and sometimes chronic kidney disease. All of these are associations, not always proven mechanisms. But it's there in the literature, it's out there, and it's recommended that you try to use the least amount of these strong acid-reducing PPI medicines that you can, or at least use them for the shortest period of time. Now, if you've got long-term bad heartburn and there's nothing else that's working for it, then yeah, we will certainly suggest using a PPI long-term. The benefits outweigh the small risks, okay? But sometimes the PPIs don't work and need something else. Sometimes people just are afraid of these risks. They hear about them and they can't handle knowing that there might be a problem. They want to find, what can I do to get off these medicines? And that's where the interventional procedures come into play, such as one I have started to do called the Tif Procedure.
Let's hold that thought. Let's take a quick commercial break. On the other side, I'm promising the listeners we're going to go in depth on the Tif Procedure on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, my name is Deanna Barron. I'm an RN with All County Health Care. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Health Care.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888 565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida, and we're back with Dr. Andrew Zwick, gastroenterologist at both Delray Medical Center and Boca Raton Regional Hospital right here in Boca Raton, with offices at Digestive Care. You can check it out, lovemygi.com. Great website. Dr. Zwick, let's get into that Tif procedure, the acronym, and I'll let you go with it here.
Tif stands for Transoral, which means, through the mouth. Incisionless, no incisions. Fundoplication. Fundoplication is the actual name of the surgical procedure that is generally used to treat hiatal hernias and reflux. The traditional surgery, which is a open or laparoscopic surgery done by a surgeon, is done to take the hiatal hernia, pull it down where you put the stomach back into position, and then you wrap the top of the stomach, which is very pliable, around the esophagus in a 360-degree wrap around it to strengthen the barrier, to cause a increased pressure, high pressure zone. So surgically, you are recreating a pressure barrier that was lost in nature. And it is the gold standard for treating hiatal hernia, reflux, and heartburn that is refractory to medications such as Prilosec, Nexium, the PPI drugs. A couple years ago, I started thinking about this problem that patients who have bad heartburn and the medicines don't work, we send them off to surgery, which can be fraught with potential complications. Of course, not everyone has complications, but there are potential surgical complications. And I know that people who have the surgical procedure to fix their heartburn often can get common problems afterwards. At least a third of them may get problems with swallowing. A third or more may not be able to burp effectively, get very bloated. And unfortunately, a good third or more get chronic flatulence, which is, of course, not always a socially pleasing thing to have as a consequence of a surgery.
Wow.
With that in mind, the surgical procedure is wonderful and very effective at fixing a hernia and helping stop chronic heartburn. But as I said, I thought about this problem a couple years ago, and I was looking for ways that we could possibly treat reflux without having to do a general surgical procedure. And there have been a couple methods developed over the few years that have been done. And recently I settled on one I think is the best for me as a GI doctor to perform, because it most closely approximates the real surgery. And that's the TIF, Transoral Incisionless Fundoplication. It's a way to reduce a hernia and to wrap the esophagus around, wrap the stomach around the esophagus to recreate a barrier to acid. Okay? This procedure is done with a device that is inserted through the mouth, down the esophagus, into the stomach, with an endoscope, a camera passed through the center of it so we can see what we're doing from the inside out. So we pass this device down into the esophagus and stomach, look back at the top of the stomach with the endoscope, and use this device to grab the bottom of the esophagus, pull it down into where it needs to be, just under the diaphragm, and then wrap the stomach around the esophagus and plicate it using little polyurethane plicators, little fasteners. They're delivered through the device, through the tissue from the inside out. So you wrap the stomach around the esophagus from the inside out. The plicators hold the tissue, and over time the tissue adheres together like any other healing wound. So it's incisionless surgery. You don't have to cut into the body to get to where you're working. It only takes, in skilled hands, about 40 minutes to do. We're doing it now at Delray Medical Center in Delray Beach, Florida. It's done under general anesthesia, so you are put to sleep by an anesthesiologist. You have to be perfectly still when we're doing this work. So you're put to sleep. And there's an overnight stay in the hospital just for observation to make sure there's no immediate problems or complications from the anesthesia or from the procedure. But the nice thing about the Tif procedure compared to regular surgery techniques is that there's really very little, if any, complications. You don't have any of the surgical complications that can come from, operating through the abdominal wall into the belly. And you don't get the bloating, you don't get the swallowing trouble, you don't get the flatulence that is associated with the typical surgical fundoplication procedure. The recovery is similar to the general surgery. You have to be on a liquid type diet for a couple weeks so you don't, dislodge what you've done. Then soft food for a couple more weeks after that. But by about 6 weeks, you're eating what you want again. There's an associated weight loss during the procedures. Most patients, because they're just on liquids, will lose anywhere from 10 to 20 pounds, sometimes more. Not careful, may gain it back once they start eating regular again. But the procedure, you can't make anyone worse. Mm-hmm. If you do the general surgical procedure, you can really help someone with their heartburn, but you can give them more problems. You might make the wrap too tight. You can't measure how tight you're making the wrap, and then you can give them swallowing trouble. Mm-hmm. With the Tif procedure, you can't really do it wrong, per se. Mm-hmm. If it works for people, and it works in about 84-90% of people that you do it to, depending on the patient, it works. And the effect so far in studies has been long-lasting, up to 3 years or more. And it's a nice alternative for people who want to try and fix their heartburn so they either don't have to take pills, or for people who just aren't fully responding to their pills. If you're taking your Prilosec and you're taking it twice a day and you're still getting heartburn and reflux, this is a way to deal with it, to, one, get rid of your symptoms, improve the quality of your life, and to avoid having to take medicine. Now, some people over time may have to go back on medications. That is true of both procedures, general surgery and the Tif, but not that many.
Oh, that's good to know.
And but it is an alternative for people who really are having this bad reflux that don't want to take pills, or find that the pills just don't work.
I see. And yeah, in the recovery time, just one night in the hospital, that's amazing. Incisionless, so there's not going to be a scar. Not that there's very big scars with laparoscopy,
there's no scars.
Yeah, with this Tif procedure, there's no scars at all.
Yeah, there's certainly in any invasive procedure, there's potential complications for everything. But there's way more in the general surgical procedure compared to doing the Tif. Now, one of the caveats, though, is that the Tif is only effective at reducing and repairing a small hernia, one that's only up to 2 centimeters, a relatively, small hernia. A lot of people have larger hernias. So what we're recommending for this is that for people who have larger hernias that aren't amenable to reduction with a Tif, is to have what's called a combined procedure. That is to have a laparoscopic surgeon, such as a fine surgeon that I work with at Delray Medical Center on this. Her name is Dr. Erica Podolsky. And what Erica does is she will laparoscopically fix a larger hernia, and then I come in and do the Tif procedure while you're still under anesthesia, which allows for the wrapping of the stomach around the esophagus, doing the fundoplication without the complications that go with doing the wrap surgically, which is the bloating and the gas and the flatulence and the dysphagia, the name for trouble swallowing. So it's a nice alternative. If it isn't effective, and sometimes it's not, it can be redone if it doesn't take the first time. And it doesn't preclude you from having a surgical wrap done at a later time if that's what's necessary. So in all ways, I sort of think of this as a prelude in most situations to a full surgical hernia reduction fundoplication. It really is I'm going to use an old-fashioned word, it's a nifty thing. It's a nifty procedure. And I believe that patients will greatly benefit from this option when they're the right kind of patients, when they meet the criteria, and there are criteria for who gets this. But when they meet criteria, it's a life-altering procedure. for those who need it.
Well, that's great news, and thank you so much for bringing this to this area. And I know, like you said before, I imagine you're probably going to be proctoring this to other physicians. You said that other physicians will be doing this in the future.
In time.
Yeah.
I'm relatively new at it too. I've just introduced it at Delray. Yeah, I believe that other physicians will eventually be, interested in doing this, in learning the technique, and it'll make it a little more widespread. I think that this type of thing will be more common in the future. There are other types of non-surgical procedures to be done, and some surgical procedures are a little bit different than the wrap for reflux. But I think that this one is likely the best choice for people because of it approximates what we know to be the best, which is the surgical procedure as far as symptom reduction.
Well, that's great to know. We're going to take one more quick break, and then on the other side talk to Dr. Zwick a little bit about his offices, other treatments available on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida, and we're back with Dr. Andrew Zwick from Gastroenterology Consultants of Boca Raton. As you heard me say before, that's part of Digestive Care, lovemygi.com. And I'll mention it one more time. Dr. Zwick has offices in Boca Raton, 951 Northwest 13th Street, Suite 2E in Boca Raton, and also in Delray Beach, over by Delray Medical Center, 5258 Linton Boulevard, Suite 202 in Delray Beach. Dr. Zwick, we got into a lot about the Tif procedure. What other treatment options do you offer? I know that's a very long list, but what are some of the more common ailments that you're able to treat?
Well, as we had talked about in my prior visit, gastroenterology is a broad topic. We do treat all sorts of digestive disorders, anywhere from the mouth down to the anus. So the common things we do, of course, and most people think of their GI doctors as the one who's doing their colonoscopies on them, for colon cancer screening. So, of course, we do colonoscopies for screening. But we also see people for the whole spectrum of disease, people with heartburn, trouble swallowing, people who are anemic for unexplained causes. Often will need a gastrointestinal workup. We need to look at their GI tracts to see if they're losing blood from the esophagus, the stomach, the intestines in some way. People have trouble with their bowels, diarrhea, constipation, the irritable bowel syndrome, or as people think of it, spastic colon, liver diseases, the whole gambit. We treat hepatitis B and C. We treat several forms of liver disease, and of course, pancreatic and other digestive diseases are a lot of what we do. So we have a broad spectrum of problems that we deal with. There's very little problems that people get, other disease entities that somehow don't have gastrointestinal symptoms to them. There are so many things cause stomach pains and diarrhea and constipation and heartburn and liver problems. So it keeps us busy. I'd say that. It keeps us very busy.
It sounds like it. And how long have you been practicing medicine as a whole here in South Florida?
I started practicing here in South Florida in 1996. So I've been here 21
years. I graduated high school.
Yeah,
I know that's 21 years.
It's 21 years here in South Florida. It goes by very quickly.
Yeah, it definitely
very
does.
Quickly.
Tell us a little bit about your education and training. I didn't get to ask you about that last time.
Well, I'm a native Floridian. Grew up in St. Pete, Florida.
Oh, the West Coast. Okay.
We're in the West Coast. And,
nice area.
Enjoyed 4 years of college at Emory in Atlanta. Came back to Florida. Did a year of research and advanced science at University of Florida. Go Gators.
Nice.
Before I moved on to medical school, University of Miami. Go Canes.
Nice. Yeah, even better.
Even better. That's right. So I didn't have a football team at Emory, so I adopted the Gators and the Canes. They're both in my heart.
And now you teach at FAU and Go Owls because they had an awesome season.
Yep,
won their bowl game.
It's amazing. I do have the distinct pleasure to instruct and teach medical students from the FAU Medical School as they rotate through Boca Regional Hospital and Delray Medical Center and other places, as well as the medical residents. And now we're also teaching the surgical residents. They now have a rotation in GI medicine that's mandatory for them. So we're enjoying the company of the surgical residents. We teach them endoscopy now, which is required for the surgeons to learn upper endoscopy and colonoscopy, that technique.
That's great to hear. Now, that FAU College of Medicine, the last few years, I know
it's exploding.
It's exploding. Yeah. It's very, what's the word I'm looking for? It's very well respected College of Medicine.
It is. They have a unique take on how they deliver medical education compared to other medical schools. And their students come from all over, and they do extremely well on their test scores. And the medical students now are getting fine residencies, and some of the residents are moving on to fellowships, even at the noted schools such as Johns Hopkins. So that program is doing very well. It can only advance farther. It's got some great leadership to it now, and I am just tickled pink to be associated with it in any way, shape, or form.
Yeah, that's great to hear. I've had a lot of doctors on the show, probably 100 over the last year, and I'm amazed at how many teach at FAU. It's just great that they're bringing in so many great local doctors, because I may be a little biased, but I think Palm Beach County and Broward and Miami-Dade County has some of the best doctors in the world. I mean, it's amazing the way things are moving and some of the procedures that you're bringing to this area.
Well, you have to remember where we live. This is South Florida. I mean, what's not to like about wanting to live in South Florida? So we attract doctors and specialists from all over the country. They talk about my Florida doctors. And people forget they're Florida doctors. Most of us lived and trained elsewhere in places, and we all come back where the sun shines because it's such a great place to be and great place to live and raise families and work.
Well, we have 2 minutes, so it's time to go to the lightning round.
Okay.
Where did you go to medical school?
Medical school, University of Miami.
That's right.
That's right. Go Canes.
And then also you did a fellowship in gastroenterology.
Yeah, I did my initial medical residency at the University of Maryland, Baltimore.
Okay.
There,
go Terrapins?
Yeah, go Terps. We took care of all the problem patients that Johns Hopkins couldn't deal with across town, and then I moved on to fellowship at the University of Rochester in Rochester, New York, at the Strong Memorial Hospital.
Wow, and then you are board certified in internal medicine, correct?
Board certified in internal medicine. Recently stopped doing internal medicine for practice, but yes, and board certified in gastroenterology is my main board certification.
That's great to know. It's Dr. Andrew Zwick. He's got offices in Boca Raton and Delray Beach. You can check out lovemygi.com, or I'll give his Boca Raton number here, 561-368-3455. Give him a call, or check out his hospitals, Delray Medical Center and Boca Regional Hospital, if you have any GI ailments that need to be treated. And thank you for listening to the You and Your Doctor Show. See you next week.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.